Hi, I'm Shalini Bharadwaj. You all are watching ITV Network's Medically Speaking. So today we are going to discuss about COVID-19 virus affecting more children this time and what are those symptoms, causes and solutions. So we are going to discuss about all this today. Today we have with us Dr. Dhiren Gupta, who is intensivist and pediatric specialist at Sir Ganga Ram Hospital. We have with us Dr. Nita Radhakrishnan, who is a HOD Pediatric Hematology Oncology at Child PGI Noida. And later on, we are going to have Dr. K.K. Aggarwal, who is a former president of Indian Medical Association, and Dr. NEELAM Mohan, who is a director of Department of Pediatric Gastroenterology, Hepatology, Liver Transplant at Medanta Hospital. Welcome to the Medically Speaking, sir and ma'am.
Hello, Shalini.
My first question goes to Dr. Dhiren. Sir, how COVID-19 virus is affecting children this time, because more often we are getting so many cases of children?
Yeah. One thing is that number of patients getting affected. Second is the type of ailment. Okay. So as compared to last year, probably because of lockdown, the babies or kids are not moving out. Now, in some of the families, primarily they are getting affected and they are infecting the adults and elderly. Fine. Now, second, looks like as some mutation has happened. It cannot be alone the cause, because now the younger population, not only in pediatric younger, but adult younger are also getting affected, like 35, 40, 45 years old, and they are landing in pneumonia. And around now we come to the type of problem these pediatric patients are having. Now, problem is most of the pediatric patient is that previously it used to be just low grade infection, and most of the families used to call me that okay, their child is also suffering, but the severity was much more in the elderly, less in the young adult, and least in the pediatric age group. Now what we are finding, more fever, high grade fever, prolonged fever, and also chest shadows are more than the previous year, and the gastrointestinal symptoms are dominating this time. They are troubling the child, they are troubling the family, and in many of the families I have found that everybody has become afebrile, means there may be no fever after 3 to 5 days, but babies and pediatric age group patients are persistently having high grade fever for more than 5 to 6 days. Though only saving grace is that severe complications like severe pneumonias are still not that number as compared to elderly and adult population.
Dr. Nita, ma'am, what is your experience?
Yeah, so my experience is basically from our institute, where we were a COVID-only center for a couple of months in the last year. So around 6 months, we managed COVID patients only, and only Hemong services were working out of a different building. So at that time, we had around 131 pediatric patients with COVID, from newborn babies till 18 years. And around out of them, around 25-30 patients were sick patients who had to be in intensive care. Otherwise, they were all relatively moderately ill patients who went home immediately or after a few days. Subsequently, we've been working as a non-COVID institute. So now this round, when the second wave is happening now, my experience is basically from our own patients who are developing, like cancer patients and other patients who we are treating, like hemophilia, thalassemia, those kind of children who are developing COVID. So this time, yes, there are many more patients this time around, because last time everybody, like Dr. Dhiren just mentioned, everybody was indoors at that time. So this time, many more children are getting affected. Every week, we have 2 to 3 patients. Like currently, there's a hemophilic, 1 thalassemic, 2 cancer patients, all affected with COVID. This time, infectivity and the family contacts are more, because they are getting picked up when we are testing them mandatory. Before admissions, we are testing them. That is when we are picking them up. And majority of symptoms are like fever, cough, sore throat, that kind of symptoms so far. It's not been very severe. But yes, the wave has just started. We need to wait and watch how it goes.
Ma'am, how is the scenario this particular after the variant has been mutated? What is the scenario this time? Is it more infectious?
So that we have data. That speculation what we are taking is from the data that is available from other countries and from the UK, and when the RPCH data has come, which says it could be more infectious, but they are not very categorically saying that it is so, and we need to be really worried about it. But yes, definitely there is some speculation that this particular variant is more infectious and it affects more children, infects children more.
We have with us
Shalini, just I want to comment one
Yes, please
comment.
continue, sir. Yeah, please.
Previous year, you know, when I used to counsel the families, I normally counsel the families, not only pediatric one. So I used to find, okay, there are 6 members in the family, and 2 are suffering, and four have escaped. Especially young generation used to escape. Now, what I am finding, little bit reverse trend. All 6 are suffering. Means the infectious rate, as per the experience, say that it's increasing, but it requires study. You know, we have got Mumbai, who is much more advanced than us regarding disease spread. Till now, ICMR should have studied. The problem is that what Dr. Nita said rightly, that we don't have data. Despite that
As
past
of
2
now,
months, we are.
As of now, we don't have any research on it.
Yeah, I don't know what is the problem with the ICMR. Frankly speaking, we lack data. And past 1 month, there may be data regarding what type of the strains we are having in Delhi, why vaccination is getting not very effective. So probably our governments lag behind regarding collection of data, assimilation. So what happens? The rumors takes place. Doctors also try to pitch in, and they try to make their small experience as a general experience. So that I feel is wrong.
We have with us Dr. NEELAM Mohan also, who is a director of Department of Pediatric, Gastroenterology, Hepatology, Liver Transplant from Medanta Hospital. Welcome to Medically Speaking, ma'am. Ma'am, what is your experience? Do you think that this time this mutant variant is more affecting children?
Right. 2 things simple. We assume that there are mutants. We have not proved, as Dhiren said, but we are finding things different because despite the spread which he said, if you see yesterday's the 1.5 lakh a day in India, that's no joke. The graph which was portrayed, I think TOI or somewhere, it has never seen that peak any time since we got COVID from whatever February, you can say 2020. So that peak, even in September, October peak has been crossed now, and it has gone very high. So the one thing which is extremely clear is that the virus is spreading either faster or we are investigating more. To me personally, I strongly believe that investigation facility has strongly increased as compared to what we did during the peak, whatever we said, September, October 20, whenever. Still, we were not investigating so many patients, and both Dhiren highlighted that is it all 6 members, maybe because they're investigating, and Nita highlighted that now we made it mandatory to see. So same thing, we have made it mandatory. Before endoscopy, we made it mandatory that all patients before endoscopy will have a COVID testing, because it is going to the whole thing, it spreads on to us, and it's not safe to do it unless it's an emergency. And now, thanks to the testing, we have testing which is, the instant test, the TrueNet test, the RT-PCR test. So we have, that's part 2 of the story, which you can discuss.
And we have increased genome sequencing as well, which is also important.
Yes. So we are assuming that based on the 2 mutants which are in the world, whether the African and the UK mutant, we think we have got both of them, and that's why we got this vibe. In short, we are saying virus is smarter than human being. And human being, we're supposed to have the best brain in the, in the species in the world. But this time the virus became smarter in mutant, and we are fed up of teaching our human being how to protect themselves, whether it is mask, whether it is distancing, whether it is the appropriate way of wearing mask, all that we could not convince humans to do that. But the virus became smart that the human beings are coming out with a vaccine and doing it. And having said that, no doubt, either we are investigating about, yes, we are seeing more children. Yes, we are seeing more GI symptoms because me being a gastroenterologist, I can say, and generally I've discussed with all my other colleagues,
Hmm.
you are finding more GI symptoms this time, like otherwise also children have more GI symptoms. So these are the two things that we are seeing, but we will take as the discussion goes, how do you classify into mild, severe, critical, and post-inflammatory syndrome. So we would be happy to touch all that in the discussion.
Dr. Dhiren, sir, at least more than 30% cases in the second wave of coronavirus are believed to have been reported due to the mutant variant itself. Sir, how this particular mutant variant is differently affecting children?
Shalini, this may be the past,
Hmm.
means say a month back,
Hmm.
and we want a recent analysis, and you won't be surprised that almost 100% we are getting a mutated strain one. So we need actual analysis, actual data. And second one, any virus, any virus when it gets mutated can harm virus itself or can harm in three ways. One is it can become less infectious or it can become more infectious. It can bind to the ACE receptor more strongly or less strongly, or also it leads to more pathogenesis, more virulence in the body and less virulence. But the type of mutation, it depends on the where the mutation is happening. If it is happening to a typical RBD moiety, then it evades the immune function also. So what is happening in the present state, what we can looking at the type of patients and the type of severity we are getting, the virus is becoming more infectious,
Hmm.
virus is becoming more virulent, virus is spreading towards more pediatric patients, and also is evading virology. Why? Because last 2 days, I had around 33 families whom I counseled, and they were most of the time doctors and 45 year old who received one vaccine, and there were 60-year-old who has received two vaccines. So 80% of the people who got viral infection were actually vaccinated, and out of them 60% were totally miss, they received two doses and they were on second week of second dose, especially doctors. So when they got infection, and some of them were getting serious infections. So 2 weeks back I said that okay, probably vaccinated patients are not getting serious infection. Done. Now, past 2 days, 3 days, I am finding fully vaccinated patients also landing in pneumonias and severe pneumonia, which is leading to low oxygen. So, what is happening over the time? We are learning what Dr. Neelam said. It's a learning curve. Virus is much smarter. He has changed its character to infect more human beings. It is evading the virus. It is evading the immunology of the human being, whether it is an acquired immunology because of virus. And yesterday there were two patients who got infection a year back, and the same patient got infection this year also. So it is a mutation that is playing, and other than the human behavior, that is almost impossible to change because people are actually fed up of the covidology protocols.
Okay, sir, we have with us Dr. K.K. Aggarwal, who is a former president of Indian Medical Association. Sir, are kids passing it more?
It is difficult to say at this moment that kids will be more contagious, but definitely this virus is behaving differently day by day. Yeah, we were saying that kids are not going to get the infection. Now we are seeing kids getting infection. We were told after second vaccine, you are not likely to spread. And now we are seeing even after second vaccine, people are getting infection and they are spreading also. So at this moment, whatever we discuss and whatever we say, I think viruses also have a meeting and they decide to they also have a meeting in the evening and they decide to change that whatever
Very true.
doctors are doing, let's do it differently. So it is totally misbehaving. Every day it changes whatever we think. So as on today, I'm very
Before you
sure.
came, I just said that human being is supposed to be the most intelligent species. And what a shame that the COVID is becoming smarter to change itself to attack us. And we human beings are not able to convince each other of the basic, convince ourselves. If I take everybody, human beings, and follow the basic protocols, because the amount of errors that is seen in human beings is much more. So I think it is time to challenge the intelligence of human being species and convince them that the virus is smart. And behold, since we are learning so much, it is time that all the basic protocol which you've been talking about in your previous more than 100 series, nearly 200 series of COVID that you've taken, is the same thing which we are still talking about, prevention and how we can prevent.
Agarwal sir, is it your webinars are being attended by these viruses and they're becoming smarter?
Maybe I don't know. We know is there is a
There
fight
is
between human
possibility.
intelligence. There is a fight between human intelligence, virus intelligence, and the vaccine intelligence. Now, what is going to happen? Now, on one side, the viruses are multiplying. On another side, vaccines are multiplying. What are the possible situations? In Israel, the vaccine overtook the virus and the virus demoted itself. In Michigan, virus and vaccine were both increasing to each other. In Chile, we are seeing lockdown after increased vaccination. That means the message has gone to so much with that. So what can happen is that if the virus is also multiplying because of the pressure of the vaccine, virus mutation will be number one. It will start mutating towards younger people because they are not getting vaccinated. So it will mutate in such a way that it will start getting infected to non-vaccinated people. That will be the first thing the virus will try to do. The virus will try to become more chronic, and we call them as a shift towards left mutation from 691 towards 69. It will shift to the left side. That means it will first come to RBD, then RBM, then RBD, and then N-terminal domain. It will shift towards the left side. That's expected. The virus is also going to shift towards causing less mortality, more infectiousness. And the virus will also, so now we are seeing E gene target failure. So in Northeast, we are getting people who are E gene is negative, RBRD is positive, so that it is not detected, because they know that government is putting pressure, reducing the cost. So therefore, people are doing only E gene. And if E gene is negative, they don't do further testing. So E gene target failure has started appearing. So whatever you do to kill the virus will mutate to escape it. That's the job of the virus, to escape. Now what is happening is now the number of the infections are increasing. The virus has to mutate because there is this virus, when it enters my body, it first translates its floppy, which he has brought a floppy of genetic information. That will now go for proofreading, then replication. Proofreading is a non-structural protein 14, NSP14, which is a part of RDRP. Now we are trying to give remdesivir, favipiravir in everybody when it is not indicated, because they are going to act only in the first 3 days. If we are going to start favipiravir on day 7, continue for 14 days, then what will happen? They will block RDRP NSP14 and the virus will mutate. So if we are putting a pressure on of unnecessary plasma therapy, unnecessary drugs, and then virus will mutate like any bacteria mutates. And that's what is going to happen. Now, what is happening at this moment is what happened in Ganga Ram, what happened in Lucknow, what happened in AIMS. Everybody is saying, say Ganga Ram started saying that we have 500 doctors. If 47 or 37 got positive, so what? I don't mind, so what? That's okay. But Why 37 at one go? Why 37 within a matter of 48 hours? And why in that 48 hours we are getting cases all over the country? Bhopal, AIMS India, AIMS Bhopal, Ganga Ram, everywhere. It means those people are, this is a super spreading event. And up till now, we were saying that post-vaccine COVID cannot spread. And here we are seeing post-vaccine COVID a super spreader. That means a further mutation has occurred. So this fight, mutations will go on occurring. Now, another thing we have to see is the last wave lasted for 2.5 months. Now we have, in this wave, we are only 1 month above. If this wave also lasts like 2.5 months, we will cross 4 to 5 lakhs per day. But the good news is Michigan, the wave where vaccination and the wave are going together has stopped at 1.5 months. So at least 2.5 lakh cases will come every day. We can't stop it. So we will close something around 2.5 to 3 lakh cases. At this particular moment, if we don't take precautions, the virus will go on mutating, 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 and mutating. So that's what I say is virus is listening us. Listening us means it is finding an opportunity कि कौन से लोग हैं जहाँ पे लोगों को म्यूटेशन जहाँ पे बीमारी नहीं हुई है मैं वहाँ घुस जाऊँ. So this viral will mutate, and that's the reason we said that 20 to 40 people age group should have been on priority, because those are the people who are not going to listen. They are the one who are spreader, and they are the one who will mutate, and they are the one who are having a mild infection. They will mutate and continue spreading the infection. Yes,
Yeah,
Neelam.
Shalini, I just want to make one
Yes,
point. I
please.
totally agree with sir. And you know what has happened? I am talking about institutions like AIMS, Bhopal, AIMS, Delhi, and Ganga Ram. We have got a very robust screening system. Our consultants get a slight cough, cold it happens in the family. They are allowed to do testing as much as possible every week, every third day, and something. So why the things have spread means what I could say personally, I found that around 37 cases over 5 weeks. Probably this happened much more rampantly 1 year back. Fine. And that time it was around 200. Now it is 37. But why it happened? My feeling is that Dr. Aggarwal can definitely agree or disagree. People, got vaccinated. That vaccination gave us little bit confidence. Okay, we can relax a little bit when we are not looking at the patient. We can take out the mask, and our vaccination was probably not that effective as we thought of. So that gave us a little bit extra confidence, and that extra confidence led to little bit, more chances to virus to get into us, and led to, even if it has happened over 4 weeks, which our data says, but why it suddenly cropped up all over India? So probably it is a change in the virus character and change in the human behavior post vaccination. As I told you yesterday and day before yesterday, I had 33 families I counseled. And what I found that most of them were fully vaccinated. I'm talking about elderlies. Those were not doctors and those were doctors. Those doctors were definitely received vaccination a month back, second dose, and those who were not doctors received vaccination around 2 weeks back, the last dose. But somehow in the family, the environment was that they were feeling, I call it pseudo confidence, that and virus was too confident after mutation. So probably the mismatch between the two led to outbreak of this infection. And my wife also works in some other hospital. So I am finding almost all hospitals have some 15 consultant, 10 consultant, and the same consultant who had infection a year back are actually having the now repeat infection. And one last point I want to make, it may be, again, it requires study, it may be just my thinking and my small experience. Patient humans who got an infection say 4 months back in Delhi around November, December, they are little bit still spared despite of mutation. So probably natural infection is leading to better mutation, not only based on probably the gamma globin, that is immunoglobin, but probably T cells also. And probably our vaccine, that is predominantly Covishield, which is said to be more producing T cell than your Moderna and other vaccines, but probably somehow the protection efficacy is not that much for mild to moderate. Till now, the only saving grace that out of say 35, 36 doctors, they were many of they were very high risk. They are still spared of severe disease. All are having mild disease. That I can say at present. But as Dr. Aggarwal said, everything is getting changed on weekly basis. So we may have to change our, our statement a week after or 2 weeks after. So things are very
To
changing
add one
and
line,
very fluid.
I just want to
Dr.
add one
Nita?
line.
If I may take a mutation are expected of a virus, right? So every virus would mutate. And so it is not that this particular strain is doing something unusual. It is expected of a virus to mutate, especially if you are encountering situations where the virus is not able to infect. So by the time, but till the time at least when we are confident that our level of immunity is best, that entire protection of us, protecting ourselves by wearing a mask, that should never go away. Why are we facing a peak? Because of social interactions. We are freely moving around. We are attending all festivals,
Not
parties,
following
whatever.
appropriate behavior.
Domestic travel has opened up so much. So this is the reason why we are getting infected. It's more than the infectivity of the virus or more than the mutation of the virus. It's because we have become relaxed as a community. So till the time we don't get our act together and get that part sorted out, this is going to keep happening. And God forbid if
How we can protect children, basically, how we can protect them, because it is very difficult to handle children.
I endorse what Nita is saying, that and all. See, right now that we are all hypothesizing. There have been both the side, both the virus and the human being. Human being behavior is also deteriorated, while the virus behavior is improved. So you will not be able to give marks as to who is, who is how strong. Both need to be. But the simple message is, I would like to ask KK, is that irrespective of it, what needs to be done is simple two things. All of us need to get vaccinated. All of us need to take the basic protections, what Ita is saying, that we need to keep our social distancing, our mask where it appropriate. And as Dhiren has highlighted, that they have definitely seen that those who have had a past infection or those who have been vaccinated, the chances of them to get into critical state, critical is, that ARDS, etc., is next to not reported so far, not people have talked about it. If at all, they've been mild, moderate to severe. So severe used to be 15%, but he thinks that majority of the people have been mild. We need not confuse public. We need to say simple message: virus is getting smart, you are getting stupid, you get smart, you use your precautions, you get vaccinated. And there are so many people whom I still get a call from, educated people, my friends are all educated. They ask me, Neelam, do we still need nahi vaccine nahi lena ji, 6PD deficiency hai, pata nahi kya hoga, like vague reasons they will have for it. So that message needs to go as a clear cut blanket statement from all of us to the community, that this is what we are saying, that yes, there are mutants, yes, we become stupid, we become complacent, yes, we need to take vaccine, double yes, we need to take our precautions. So that message I don't
Yes,
dilute.
Dr.
add.
KK, sir, how to
Yes.
protect children, basically, because we don't have vaccines for children. How we can protect children?
Correct.
So
Very good.
first of all, a good
So how
news.
we can protect children
First of all is
is that the children get the infection only from adults so far. Still now we know that children are not going out schools and
Yes,
all.
yes.
Yes, we are requesting parents that evening time now we are allowed them to go play with each other and all that, because they were upset. So I've also tweeted that it is time we need to ask the children to get back into some indoor games. As KK highlighted, we are into worst wave. Not we have seen 1.5 lakh, but KK thinks we'll go to 2.5, 3. So we need to get down to our lockdown. How the lockdown is, as Modi ji says, self-imposing lockdown. You don't want somebody to tell you to do lockdown. You yourself self-impose lockdown.
That's
That is
important.
very important. The parents need to, and children get it usually from the parents. We have been investigating the children. So unless the children are symptomatic, it's a question whether you need to investigate or not. But more important than that, I want to give the message is, when parents come to us and ask this question, कि डॉक्टर साहब मैं पॉजिटिव हूँ, द मदर इज पॉजिटिव, मदर वांट्स टू नो कैन आई सेंड माय चाइल्ड टू माय ग्रैंड पेरेंट्स, नाना नानी दादा दादी? Answer is big no, no.
Yes.
Because they will actually give rise and spread to the grandparents.
Because they are the super spreaders.
Mother or father is positive, please keep the children with you. Even if you're positive, you use mask as parents, use mask, use your precautions, keep there. But yes, if you're breastfeeding, please continue to breastfeed. Please continue to have your child. Do not send your children to grandparents, because they will have more comorbidities and will have get into critical phase. Till now, whatever request I get on phone calls for beds, I mean, the last 3 days I've got dozens and dozens of calls. All of them have been above 60 for whom they've requested me. Majority of them have been 65 to 76, 78 that I got the calls. Ki, can you do? So all those who are getting, so stay away. So the message for children protection is, do not send them actually to grandparents. Keep them with you. Allow them not to mix much with the other parents. Do a self-imposed lockdown. That's what I would have had to say.
So I just want to add one thing is, good news is Sputnik has been cleared for EUA by India. I just saw the news. So that will be a good sign. Another vaccine has come to India. One message everybody must understand: don't compare our policies with the West, because their vaccines or our vaccines are not comparable.
Correct.
If they are saying, CDC says that this vaccine is like that, remember that's 95% efficacious. So they will get only 5% infection rate. In India, 30% of the people who have got vaccine will develop COVID-19. That's what the government itself is saying. The manufacturer is saying, I am only going to give you 70% protection. So 30% will develop corona. Whether it is mild or moderate, it's a separate debate altogether. Which corona they will get. Now remember, today 3 coronas are happening in the society. Corona number 1, primary corona, which can be 614 corona or which can be 6970 deletion corona, is a separate issue. The second corona we are getting is reinfection corona. That means people who have developed corona, now they are getting reinfection. And the third corona we are getting is corona after vaccination. All 3 may behave differently. All 3 may require different intervention. All 3 needs to be clinically separated altogether to find out what they are seeing. Peculiar thing what we are seeing in adults. Number 1, we are seeing systemic inflammation, what pediatricians used to see in severe multisystem inflammatory disease. We are getting mild non-pulmonary, extrapulmonary systemic inflammation in patients. Vaccine after COVID or COVID after vaccine, we are getting these people, very high fever, very high CRP, D-dimer coming positive on day 2. Some of them are going down to low platelet count on day 4 and day 5. I'm not talking about the clots of the West, but this is a pattern we are getting. And I say there are 2 types of inflammation going on in the society: Th1 inflammation and Th17 inflammation. Th1 inflammation is lymphopenia, and in Th17 there is increased polymorphs. Clinically, they may have the same increased NL ratio, but in one, it is lymphocyte which has been used. In another, lymphocytes have been suppressed because of increased neutrophils. Both of them may require a different type of a treatment. So Th17 response we are seeing after vaccination. I have seen patients of psoriasis getting worsened, rheumatoid getting worsened after vaccine. So all Th17 disorders, when you are giving this vaccine, they are getting slightly exacerbated. So therefore, at this moment, this virus, it was teaching us TH1, then it started teaching us TH2 when we started vaccination. Now he says learn TH17 inflammation also. We don't know what else he's going to ask us. So he is going to ask all gynecologists, pediatricians to become immunologists and forget about everything else. Go ahead,
Thank you
Shalini.
so much, sir. Thank you, Dr. Dhiren Gupta, Dr. NEELAM Mohan, Dr. K.K. Aggarwal, Dr. Nita, for joining us on medically speaking and sharing such a wonderful and important information which is required as of now. Thank you so much.
Thank you so
Thank you,
much, sir,
Shalini.
for
Thank